everyone, and welcome back to another exciting episode of MedSynapse podcast series, where we explore the latest innovations and advancements in medical field. I'm your host, Hetvi Shah. But first, let me introduce to our guest for today, Dr. Raxith Sringeri, a highly respected consultant surgical oncologist at Bharat Hospitals and Institute of Oncology in Mysore. Dr. Sringeri specializes in surgical oncology and minimal access surgery with expertise in performing complex oncological procedures across various domains and robotic surgical oncology. His insights and experience are truly invaluable, especially as we delve into today's topic, the impact of robotic surgery on cancer treatment. So, welcome, doctor, and it is a pleasure to have you today.
Thank you so much. Myself, I'm Dr. Raxith Sringeri. I'm a consultant surgical oncologist and robotic surgeon. Again, it's a very nice topic from the MedSynapse, the robotic surgery, what the future of cancer care holds for. And in 5 years by time, the robotic surgery will be the standard of care for any treatment.
Yes, truly said, it is a booming industry for sure. So, to start with, robotic surgery has seen significant advancements, as you've mentioned, in recent years. So, how would you describe the evolution of robotic surgery, particularly in the field of oncology?
Okay, when it comes to oncology, the three things that is very important to us. One is the removal of the tumor with a good resectant margin. Second is that to prevent the healthy tissue as much as possible. Nowadays, the most important aspect is the early post-operative recovery, so that the patient go back home faster, so he can take other treatment like chemotherapy or radiotherapy faster. So what robotic has done this, it has answered all our questions. Again, because of the precision. Initially, we used to struggle with open surgery because it is only two-dimensional. With the evolution of robotics, we can three-dimensional perception. We can preserve as much healthy tissue as possible. At the same time, we can remove the tumor, and the patient, majority of my patients will discharge on the second or third post-operative day, and without any drains and all, with less post-operative pain, and they're going back to work very early compared to the previous era of open surgeries. Again, the robotics have evolved so much nowadays. Not only from it started in 1985, where it has started used for biopsies. Now, what we are doing is doing for all complex surgeries, the robotics has taken over. Now, currently in 2002, there is integration of artificial intelligence and augmented reality, which gives a better perception, better precision, and better post-operative care.
Yes, we have seen AI just boom the industry recently, even in healthcare. So,
Exactly.
it sounds like, robotic surgery is not only enhancing and making life easier for doctors, but also it is improving patient outcome also, like overall patient experience.
Yes.
So now, building on that, what would you say are the primary benefits that robotic surgery offers cancer patients when compared to conventional surgical methods?
So I already told you, one is the prevention of healthy tissue. When we are doing the surgery, we're going to prevent majority of the healthy tissue. Okay. So now, initially when I started my cancer surgery career, it was a radical surgery, which means if somebody comes with a throat cancer, remove entire throat. If somebody comes with a breast cancer, remove the entire breast. It was very radical surgeries. Now we are going to the era of organ preservation approach or organs preserving approaches. So robotics helps in doing this organ preservation. For example, if a throat cancer patient comes to me, my approach will be robotic surgery. I can save his voice. He can talk. He can breathe normally through his nose. So this organ preservation approach has taken a drastic change. For example, if a kidney cancer comes, old tradition was to remove entire kidney. No, nowadays not required. With the precision of robotic surgery, I can still preserve the kidney. Patient can have very good kidney function outcome. So that has evolved so much. Not only that, what we used to do after doing an open surgery is the patient has to wait for 4 to 6 weeks because of his post-operative complication. He has to wait for so many days to recover from his post-operative pain, complication, it drains everything. Nowadays, nothing is there. With the evolution of robotic surgery, patient is discharged on majority of the patients are discharged on next day. For example, lung cancer patients, surgery used to be very huge and very traumatizing. Now, patient is getting discharged on next day morning without drains, nothing. He is breathing normally, and in 7 days, he's coming back to us with a chemotherapy, with smiling, no drains, nothing attached, no post-operative pain. Again, so what is the long-term benefit? I'm going to ask. I'm going to tell you is that the initially the patient was thinking about a cost effectiveness. It is very costly, but if the patient is getting back to work within 1 month, so he's going to earn as much as there is no need to take a leave and everything. The patient has to be cured in a very short form of time. Again, the post-operative pain is the most amazing thing. The recovery is the can't imagine the recovery time. It is very drastic and very early. Second is this curing capacity. The curing the cancer is become very. Nowadays we can cure majority of the cancer with the precision using a robotic surgery.
Yes, like it is rightly said by you that they are less disruptive to the patient's body, which is especially important in cancer care.
Yes.
So now, considering the advanced nature of robotic surgery, I was just curious about the training involved. So what kind of training and workshops are required for surgeons or healthcare professionals to become more proficient in these robotics assisted surgeries?
So there is always, the basics has to be right. You have to be very good in open surgeries to learn a robotics. Okay. So the robotic surgery trainings are available across the world. Majority of the institutions are providing a robotic surgery. It is a very highly, you need to be very skilled. You should be very trained, and it requires lot of motivation, lot of dedication to learn a robotic surgery. But once you learn, it becomes a game, or it becomes very simpler for you. The most important aspect when I tell surgeons is that robotic surgery makes surgeons' life very comfortable. For example, if I'm doing an open surgery, I'll be very tired back going home. When I'm doing a robotic surgery, I'm very much lively, and even after doing a very complex surgery, I'm very lively. I can go back home. There is no fatigability. The surgeon fatigability is almost less in robotic surgery compared to open surgery. Again, training is there. We need, for example, I was trained in robotic surgery for 1 year, and also I was trained in SEO. So there are so many things, advancement. See, the one good thing and bad thing about robotic surgery, the robotic surgery is constantly evolving. The technology is constantly evolving. Like a software engineer, we need to get evolved to the current technological, what are the situation. Currently, what I'm telling is an augmented reality. Incorporating into robotic surgery is become very, for example, I can see an X-ray CT scan on my, in the monitor only, in robotic monitor only. So those kind of integration is going. So again, it is a constantly evolving patch. As a surgeon, we need to keep updated with our recent technology, keep upgrading our skills. And there is always a myth. It's not a robot that's going to operate. It is the surgeons. It's a robotic arm that is going to operate. So it's your skill that is transformed into the robotic arms with a better visualization. The 4K 3D visualization is just an amazing fact. So it's giving a better precision. Again, training is there. For example, the laparoscopic surgery used to take a longer training period compared to the robotic. Robotic surgery is a shorter learning curve. It can any surgeons can learn the robotic surgery, but you have to upgrade the skill constantly according to the technology which is available in the market.
Yes, actually, you have also addressed one important question for all the doctors, that will AI actually take place of doctors or humans? But no, it will not. Surgeons are obviously needed.
Yes, the AI will help you. For example, I'm doing a robotic surgery. The AI will tell me where exactly the vessels are located, and also help me where I have to suture. It will help in differentiating between the tumor tissue and the normal tissue. Yes, but it is still, you still have to believe on your gut feeling, your skills, and also your vast experience. Okay, there is nothing can replace experience. No AI can replace for your experience. No AI can replace your skill level. Again, it is all the judgment of a surgeon that helps in good post-operative outcome. It doesn't matter whatever the technology advances, it is still a human touch. It is required for curing the humanity.
Definitely, that is very true that you've told. So now, doctor, in your practice, what have been some of the most significant improvements in patient outcomes that you have observed since you started using robotic surgery?
See, the most important aspect is the lung cancer. Okay, the lung cancer. See, we have to open the ribs. We have to go inside. We have to lung tissues, the tumor tissue. We have to remove the post-operative pain because we are separating the ribs. So the patient has to be on drains for the longer time. Patient has to be on the ICU backup. That's what the most important aspect I've seen in the lung cancer surgeries. Again, I put a robot. I can see the tumor tissue. I put a stapler to the robotic patient. I'm coming out of the robotic. Patient is completely fine within 1 hour after surgery. Next day morning is going back home. The second important aspect I have come across is something called ovarian cancer, or called women cancer, or gynecological cancers. Okay, so these are called pelvic cavities. Pelvic cavities are called the narrow cavities, which becomes a hell for a surgeon. Operating in those narrow cavity, which is very hell, especially if there is a ovarian tissues or ovarian cancer tissue or endometrial cancer tissues that is adhere to the pelvic side wall. It is very traumatizing for the patient as well as for the surgeons because very difficult surgery. What made me simpler for me is the pelvic surgeries. So I can do a ovarian cancer surgery, or you can say uterus surgeries, without anybody's assistance because all the 4 arms are under my control. I can control the camera and the visualization. I can see up to the deeper tissues. I can see the smallest of smaller vessels, and the recovery time is exemplary. I will always talk about the patient comfort also, but when you're doing a pelvic surgery, the surgeon's comfort is absolutely good in robotic surgery. See, initially when I used to do open surgeries for uterine and ovarian cancers, when I go back home, it is like I've done 1,000 push-ups or I've done something else. But in robotic surgery, I feel like fresh. So if I can finish a pelvic surgery in 3 hours, that's it. I can start again. So that the freshness, the surgeon's fatigability, that's what actually highlight in robotic surgery. Rather than patient outcome is good, yes, but also the surgeon's fatigability is also less. If surgeon is less fatigued, he can give a better care for the next patient is going to operate. So that is actually, if somebody is asking you why you are considering only the patient outcome, it is also the surgeon's comfort. Surgeon is comfort, the patient can get operated in a better way. So all these are there. The precision, the cure rate, patient post-operative recovery, complication rate, and as well as the survival of the cancer from the robotic surgery is significantly increased. There are so numerous articles which says that the robotic surgery increases survival mainly because of 2 things. One is the precision. Second is that these patients can get the adjuvant treatment like chemotherapy and radiotherapy faster compared to the open surgeries. So that's what it is giving the survival benefit. So the robotic surgery definitely helping in survival, not only for the patient and also for the longevity of the surgeon. Surgeons also can live longer nowadays.
Yes, definitely. And it also reduces the chances of surgeon burnouts or physician burnouts.
The surgeon burnout, there is, see, you are talking about artificial intelligence. See, no matter what, there is some kind of human error will be there. What is this artificial intelligence is helping is to reduce those human error as much as possible. So because it's a life of the patient we are dealing with. So lesser the human error, the better for the patient outcome. So AI definitely going to help in reducing the human errors. So the AI will not take over the human, but it is going to reduce the human error. There is the chances of human error. No matter how good they are, there is a chances of human error. The AI is help you to reduce those human error as much as possible.
So ultimately, it is going to be beneficial for both. So it is good.
It is a fruitful for both for surgeons as well as the patients.
Yes, true. So now looking ahead, that you had mentioned earlier that in the 5 years, coming 5 years of robotic surgery. So what are some of the latest innovations in robotic surgery that you believe will further revolutionize cancer care?
See, the one more thing is this: there is a putting a port up down. See, we have to put up ports. We have to put multiple ports. What is recently in the Baltimore, USA, there is a conference regarding the upgraded technology in robotic surgery. The most important thing came out is a single incision. There is only one port can be inserted to the abdomen, with all the four arms are coming to that port. That's a miniature version of the robotic surgery. Again, that's even the perception, the depth perception or visualization is further increased by 100 times. So it is like you are doing a tissue surgery. Like you can see the microscopic tissue surgeries. with a single incision. It's a single port incision, nothing much, no major incision, no bigger incision, no multiple ports. It's a single incision. Second, the third most important aspect which is coming is the what I told you, the artificial intelligence. For example, I'm doing a pancreatic surgery. It has helped me. What are the steps I need to follow? So what is helping me? This is the first step you have to follow. If that first step is followed, that is patient is operable. Okay, so this artificial intelligence integrated with the robotic surgery, it helped me to guide the pattern of step I have to follow most efficiently. So this is the second most of it. The third most fascinating thing I have heard in USA was that on table we are able to implant or generate an artificial implant. For example, bone implants can be generated within the OT, and the instruments according to the patient needs and abdominal size, the pelvic cavity depth, the instruments are generated on spot. So that, for example, they're using one robotic arm, it will be very costly. If your robotic arm does not reach the tissue you want to there, that is going to waste. So these things, what instrument I have to use, that artificial intelligence help me to guide. So this is the precise instrument. This is the length of the instrument I use for this patient. How much is the fat density of the patient are there? How much I have to penetrate? Everything. Again, this is something amazing. I told you there's a human error that drastically reduced by A, and also the precision, and also you always think about the cost effectiveness. Again, all this going to be costlier, but when you think of a longer term, this is actually going to boom the economy of the nation, because this patient is going back to work and I'm not wasting the resources. So you have to always think of a longer term. Okay, so the future is going to be very amazing. And also I told you there is an augmented reality, something, for example, I don't have to read a CT scan and go back to OT. Inside the in OR chamber, inside my patient, in the console, so surgeon's console, I can see the 3-dimensional visualization of my CT scan of my patients, and it localizes where exactly the tumor is there. For example, for a liver cancer, there is a liver mets is there. Okay, so what we have to do is we have to do a radical surgeries. Okay, because entire half of the liver we have to remove. Now, what is this augmented reality or artificial intelligence is helping? Exactly the precision of where the tumor tissue is located, how much centimeter margin I have to remove. It will help me to guide it. It will mark it on the monitor, so I can take out the tumor very precisely without damaging much of the liver tissue, so that the patient can go back home very safely. So the technology is very much advancing. I think it is going to stay. It is going to help the humanity, yes, but it cannot replace the human. But it definitely makes the post-operative outcome, the cancer outcome will be much better in the future days to come.
Yes, the future is so exciting, especially in oncology. So now, while advancements are obviously so impressive, there are always challenges. So in your opinion, what are some of the current limitations or challenges associated with robotic surgery in cancer care?
The most important challenges I face is the cost. The cost effectiveness. Everybody thinking about the cost. Again, it is a costliest procedure, but nobody is thinking of a longer term. Okay, for example, these patients going back on next day morning without post-operative pain. He's going back to work. So the longer term benefit is still yet to be achieved in India. In Europe nations and USA, the robotic surgery has taken over the open surgeries. Majority of the surgeries are done by the robotic surgeries. Again, simple fact is that because this patient is going back to work as soon as possible. The second most is the availability. The 2-tier cities are still yet to get a robotic surgery. Again, yes, the training, the adequate training. If you ask me, the robotics should be the part of the academics in the surgeon training program. The minimal access surgery, again, the patient has to learn from the basics. The more sooner he starts, better for himself and for the patients. Again, the training facility should be available. Look and corner of this India. Again, the most important fact, there is always a myth. So if there are so many quacks who are practicing, they're going to put a false information. They say it's a robotic going to operate. If light gets switched off, what will happen? If internet is going to switch off, this is all the myths. There is nothing like that, light getting switched off or internet going to be slow. Nothing. This completely works on different technology. These myths, still the patient comes to me and asks me, sir, if robot becomes something will failure, if there's something break failure, like a patient literally comes and asks me, there is a break failure, what will happen? There is any safety precautions? No, there is no myths. There is nothing called break failure. Nothing. It's just an arm. Everything is controlled by the surgeons. Okay, there is nothing called lack of of power or lack of internet that's going to affect the patient outcome. So it is the driver who's going to drive this car safely that matters. Okay, so this really going to is the biggest myth. Majority of my patient is question is same thing. Does robotic is going to operate on me? So no, it is an arm that I'm going to operate. It's a myth. The myth we have to remove. The second most important fact is that the cost effectiveness. The costness is everybody is worried about the cost, but the longer you should always think of the longer outcome. So these two are the main. The last thing I want to tell you is, like when I'm buying an iPhone 14, soon after there's a release of iPhone 15. So there is an advance in the technology. Similar thing with the robotics. Soon I have started using XI, that is a current generation robotic surgery. Right now we have a 5th generation robotic surgery. There is a rapid update in the technology. So this rapid update into technology, it is very difficult for any institution to invest so much. Okay, this is the robotic surgeries instrument means that entire system is only very costly. Again, we have to upgrade. Again, it's very costly. So that the rapid upgrade to the technology, again, this is also a challenging fact. But again, sooner it is going to take over. I think the technology will start updating, and soon as the hospitals try to update for the latest technology. So right now in India, the cost and the updating the technology is what the challenging aspect. Again, yes, the training. I think nowadays in every major cities there is a training program for the robotic surgeons, and majority of the metro cities now robotic surgeries are available. And only thing is that the insurance companies and the government should make sure that some of the surgeries, the robotics should be the standard of care. For example, in my opinion, every citizen of this India should deserve a standard of care. So the robotics, there is some cancer surgeries, the robotics definitely going to help them, not only the financially, but also the emotional and the total burden to the hospital itself, into the government itself. I think so. In those areas that the government should look after, make sure this robotic surgery should be the standard of care, or at least give some kind of an insurance or some kind of a benefit to the patient so he can afford a robotic surgeries.
Yes, truly said. I think comprehensive approach would also help a lot in this. Spreading the right knowledge and everything is also important.
So we have to. I think we doctors also need to be aware of the robotic surgeries. Again, see there is a lot of benefit rather than negative aspects of robotic surgery. Again, the robotic surgery is definitely going to be the future, and I think all the doctors should be aware of this robotic surgery. Some patients comes and ask if it gives the benefit. Yes, robotics is definitely going to give a benefit, and if given a chance, you should offer them a robotic surgery.
Yes, so the advantages are more than the disadvantages, and disadvantages can always turn into advantages now. So before we wrap up, one last question would be, in your experience, what has been the most surprising benefit or outcome over the years of robotic surgery, and that you actually did not anticipate earlier?
One example I can give you is the young patient, is an ovarian cancer patient. Okay, she was a school teacher. Okay, the ovarian cancer patients, you can imagine the surgery is it's a very radical surgery. The patient, she's a teacher. Okay, she took a leave for 6 months, thinking that she'll take 6 months for recovery. So we did a robotic surgery. She recovered well. Within 1 month, she came back with us, I think some of the students, and she came to us and she introduced herself and the students that I'm getting back to my work as soon as possible without any pain. She's feeling comfortable and she's teaching well. So the most fascinating thing I can think of is that the patient going back to their routine work. So if you ask me, in this modern era, how many of us want to sit in home idly? Nobody want to go. Everybody want to get back to the work, whatever the work they are doing. If they are passionate about doing the work, they should get back to the work. None of the disease should stop them doing what they love. So this is what most fascinating thing about robotic surgery. I can see my patient going back happily to their work and coming back to us and telling us, sir, I'm going back to work. No matter what people might be saying, I want to take 6 months leaves. That won't happen. See, the work is part of our life. And this is not life, but still is a part of our life. Getting back to the work, getting back to the family life, getting back to the quality life, that's what we all love to do. We all love to care for. So this robotic surgery definitely going to improve the quality of life as well as the professional as well as the personal work. This is the really fascinating thing I can think of robotic surgery.
Yes, that was an impressive answer and impressive case example as well. So, as we wrap up today's session, I would actually like to thank you and let me tell you that it has been an incredibly insightful discussion. And thank you so much for sharing your expertise on how robotic surgery is actually diving and it is looking into the forefront and the future of healthcare. So it was so exciting to hear this.
Very sincerely thank you for giving this opportunity to talk about robotic surgery. I think through this, I think majority of the people should aware of robotic surgeries, and I think I'm sincerely and heartily thankful for you to give me this opportunity to talk about robotic surgeries. And there's a future in robotic surgeries brighter, as well as the cancer care. It just looks very much brighter in India as well as across the world. And thank you so much for the opportunity.
Thank you so much for those kind words, Doctor. And to our listeners, thank you for tuning in into this episode of MedSynapse podcast series. And remember, if you are a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate to join us on MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So, until next time, stay updated and stay tuned for more such discussions. Thank you.